Hello, everybody. This lecture is going to cover infant development, nutrition, and health promotion, highlighting the psychosocial development, cognitive, physical, and social development and achievements of infants. So infancy is the period of time between birth and 12 months of age. This period of time is marked by dramatic changes in physical growth and achievements. We covered the physical growth aspects in the growth lecture, so I won't make you listen to that again, but be aware of the separate lecture and refer to it if needed. This period of time is when infants go from having the world brought to them to learning to engage with the world on their own. So the first psychosocial stage of this is trust versus mistrust. Erik Erikson's theory of psychosocial development is one of the best known theories that helps add to our understanding of children's psychosocial development of personality. And this does occur in stages. Each stage builds on the successful completion of the earlier stage. And so if you zoom out of it and think of these stages in the context of your own life and experiences, they really do make sense. So this first stage centers around the idea of the infant's basic needs being met by their caregivers, leading to trust. Do their cries result in a response and meeting of their needs? When trust is achieved, the infant develops secure attachment and can experience unfamiliar situations with minimal fear. Now, interestingly enough, if the needs of the infant are met before being vocalized, this can be equal to not meeting them at all. So neither situation helps the infant develop trust. So there is a fine balance here. Understand that these stages help nurses anticipate patient reactions and modify your responses needed to improve communication. So this is knowledge that can be applied to all age groups, not just peds. As you learn of all of the stages of psychosocial and cognitive development, as you can maybe guess, adults don't always achieve complete cognitive or developmental growth. And so you can apply these stages to anyone and everyone everywhere. Just to reiterate some examples, for infants, providing food, comfort, and love and stimulation can help foster trust. So there's one other theorist you're going to hear about in peds, and that's Piaget. His theory covers cognitive development, and while you'll see these substages of sensory motor, they are not necessary to break down. So just be aware that infants in the first 2 years are experiencing their world through their senses. Their mouths are the primary pleasure producers, and this is why choking is a risk, right? They are tasting, hearing, touching, smelling, all these new things, and they want to figure it all out. This is the time when children become little scientists. Everything is discovered through trial and error. You know, if I throw this cup on the floor, what happens? If I put this in my mouth, how does it taste and feel? Cause and effect relationships are the cornerstone of this type of learning. So these patterns start to form, and then this will lead eventually to deliberate actions. So as you may have noticed on the last slide, these three terms were in bold. They are the three crucial events that occur during this sensory motor phase. Separation occurs when infants realize that they're separate from objects or people in their environment. Peaks at around 4 to 8 months of age. And so then this leads to their understanding of object permanence. And you've probably heard the term out of sight, out of mind, and that's what this is. Permanence means a state of lasting or remaining unchanged, right? So when infants achieve object permanence around 9 to 12 months, they know people and objects exist when they cannot see them. So peekaboo is a great game at this stage. Babies will look for a covered item at this stage. So, if you were to cover a rattle before object permanence, they'll just assume it's disappeared. But after they've developed object permanence, they will actually move whatever you used to cover the rattle and try to find it. So we can take all of this new info and see how it applies to their social development. Okay, attachment is directly related to their experience with trusting their caregivers. Having needs met leads to positive attachment, which has been proven to then lead to positive social and emotional development later in life. Separation anxiety, we kind of touched on already. It's connected to separation and the development of object permanence. Fear of strangers is very normal around 6 to 8 months, especially with a strong and healthy parent attachment. And so some ways that parents can ease this is by practicing leaving their infant with trusted caregivers or introducing them to new people and places slowly. So while the rate of growth and development differs from child to child, the progression is ordered and predictable, and you're going to see this kind of coming up over and over through development. Now, I've already mentioned and forewarned you that there are a lot of ages and milestones that you're going to need to memorize. I'm here to apologize again, but infants are complex. I don't make the rules. I just teach them. So since every child is different and there's definitely some margin of error with some of these guidelines, we typically don't label a child as delayed until there's a pretty significant period of time where we aren't seeing what we expect to see. A social smile, for example, at 2 months is, while delightful for parents, also tells us, that the child's eyesight is developing. And if it's missing, it might clue us into a potential neurodevelopmental disorder. So the following charts highlight some milestones in social, language, gross, and fine motor development. This is also in your ATI book. The starred ones are the most important, but you should familiarize yourself with all of them. I really can't speak tonight. Language can indicate a hearing or speech disorder, right, if the milestones aren't met. Crying is the first form of verbal communication, even if there's no words. So those sounds will then begin to change, and they will go into coos by 2 to 4 months, eventually to squeals at 6 months with imitation of sounds, and eventually chained syllables as that child begins to put together what we consider language. An important tip for thinking about physical development and milestones is that it always goes in an orderly sequence from head to toe or center to periphery. So this can be seen in your motor milestones as infants gain strength in their head and their neck and then move down to their torso and eventually their legs. They also master larger movements before fine-tuning them, such as grabbing with a whole hand before learning to use their fingers. So center to periphery, okay? Monitoring these milestones is important, but keep in mind again, a delay does not always mean an underlying problem. Most kids will master them. It just might be a bit later than other children their age. Some other potential impacts could be prematurity or genetic conditions or autism. And, in that case, things should be considered because early intervention is important to assist these children to meet their milestones, things like speech and physical therapy. So just as a quick example, these are my two girls, both at 9 months. Emmy is on the left. She was a 29-week preemie, and Addie on the right, who was full term. So at 9 months, Emmy was very much leaning over. She was hypotonic, so she had low muscle tone. And that little triangle toy there was actually placed so that she could support herself in a sitting position because she was very floppy. But by 9 months of age, Addie, on the other hand, was sitting unassisted and already cruising on furniture. And you can see in this photo how much more support Addie has in her back and how her arms aren't even holding her weight on the ground, whereas Emmy has that sort of lumbar spine curvature. And she's kind of using her hands in between her legs to support her body. And then moving up to standing with support, same window, similar height, 7-month difference. Okay, Emmy was still 2 months from walking alone by 16 months. She didn't walk till she was 18 months, though she could cruise by this point. She cruised for a long time before she decided to let go and just be on her own. Addie was just starting to cruise at 9 months and would be walking by 12 months. Both of them are just fine now, okay? But there are definitely differences. Emmy's was obviously caused by prematurity, but I think this is kind of a really good depiction of just similarities and differences. And even in this picture, like Emmy was about the same size as Addie if you take a look at them. So just kind of interesting seeing it side by side. And then moving on to fine motor development, this includes your small controlled movements of the fingers and the hands. This is a fairly condensed list, okay? Your book has quite a few more, but this gives you sort of the basic overview of the progression. So utilizing the milestones mentioned in the last few slides in clinical is a great way to take to the bedside if you want to interact with infants that if you've never done it before. You could check for their reflexes. You could see how they move their hands or get them to smile or coo at you. And these sorts of activities will not only help you understand and see those actions in person, but they're also really simple ways to play with babies. So one of the gross motor behaviors we monitor is head control or head lag, and this helps babies to achieve postural control, helps them lift their head when prone to decrease the risk of suffocation. And so some ways that we can increase head control is with tummy time, where the infant is placed in a prone position while supervised for play. And then this also helps prevent head flattening or plagiocephaly, which can occur when babies spend too much time on their back and they get that flat spot on the back of their head. And those are the kiddos that you might see in helmets to kind of remold their skull. So tummy time is good for a couple different things. And this image here below shows that progression of head and neck control from 1 month of age to 2 months, where you have a bit of a partial head lag, and then almost none at 4 months of age, where that baby's literally like biting his own hands because he can curve himself up so effectively. Similarly, here's a progression for sitting. Now you can see the 1-month-old is basically eating her toes. The 4-month-old is about where Emmy was at 9 months. That actually kind of looks very similar, okay, with that curved lumbar spine and requiring support to stay upright. And then by 8 months old, both hands are off the ground. Now, I think it would be a gross understatement to say that parents of infants have only a few concerns, because really there are so many, but we're just going to focus on 3 today, okay? Thumb sucking, pacifiers, and teething, which are all orally related. So teeth, the eruption of teeth varies widely, anywhere from 6 to 10 months of age, but the order in which they appear is, once again, as it all is, predictable. Okay, the lower central incisors come out first, followed by the upper central incisors. Teething can be difficult for parents due to infant irritability and disrupted sleep. Some babies can show minimal signs of teething, like drooling or finger sucking, and then some others might have more severe signs. But there are things we can do. Cold teething rings or cold washcloths can be soothing. If the child is truly uncomfortable, you can give Tylenol, or if they are over 6 months of age, some Motrin or ibuprofen. It is important to note that teething does not cause signs of illness. This is a common misconception that is incorrect. The mild fever is actually an inflammatory response, and it is mild, okay? So this is not like a 101-degree fever. That would actually be an illness. Infants should have a dental visit within 6 months of the first tooth eruption, so basically by 1 year of age, in order to begin developing comfort with the dentist. Obviously, there won't be many teeth to check, but it helps establish a routine. Now, pacifiers and thumb sucking. This can be a contentious topic. Sucking provides comfort and pleasure for infants, and it can also provide pain relief. However, it is important to find out patient or parent preferences before offering a baby a pacifier. Effective breastfeeding latch and suck should be established before offering a pacifier. However, once this occurs, the American Academy of Pediatrics does recommend a pacifier to reduce SIDS, or sudden infant death occurrence, for the first 6 months. And even without a pacifier, some babies may suck their thumb or their fingers for comfort, and a shift of their teeth may occur if sucking continues beyond 4 years of age. I personally sucked my thumb till I was 11, and yes, I had braces for 3.5 years, but I'm also pretty well adjusted otherwise, so take that as you will. Now, quick overview of nutrition. So nutrition plays an integral role in growth and development. Infants should be exclusively breast or formula fed for the first 6 months, and the AAP recommends that it continue through the 1st to 2nd year or longer, as desired by the parent and infant. While breast milk has benefits, it is important for the nurse to provide accurate and unbiased information when educating parents on what feeding approach to use. Feeding guidelines will be the same regardless, so whichever feeding options the family chooses, they should feel supported. If the child is breastfed, a vitamin D supplement should be started. It's about 400 IUs, because breast milk is just not a sufficient carrier of vitamin D. And then solids are typically introduced at about 6 months or greater. The child should be displaying signs of readiness. So can they hold their head up? Have they lost their tongue thrust or extrusion reflex? Are they interested in your food? The GI tract also needs to be mature enough to properly absorb solid food before they can eat anything. They like to say that food before 1 is just for fun. Solids should not replace breast milk or formula. In the US, iron-fortified cereal is typically recommended first due to the iron content, but really any single ingredient food can be offered. The key is to only introduce 1 new food every 3 to 5 days, and that's in order to monitor for allergies or intolerance. It's currently believed that earlier introduction of high allergy foods like peanut and egg can actually decrease allergic response. It used to be the opposite. They'd make you wait. And 100% fruit juice can be offered, but that should really only be in small amounts and as a treat. Infant health promotion revolves around providing anticipatory guidance or proactive counseling that addresses specific developmental needs at each stage in development. So for infants, we're going to specifically focus on screenings during this time period, sleep safety and habits, safety concerns for infants, and immunizations, okay? Or to continue with the screening, sleep safety, alliteration, shots. So the first year of life is a period of rapid and crucial growth and development. We've said this a lot. So you can only imagine there's going to be frequent wellness visits to monitor progress. The AAP recommends that infants be seen by a provider at birth, and then approximately 1 week of age, and then at 1, 2, 4, 6, 9, and 12 months of age during that first year. So lots of appointments. This schedule is framed to monitor all the rapid periods of growth that occur. Along with this time frame, they're also going to receive many of their many immunizations. There's some other screenings that can take place during these visits, and those include the Ages and Stages questionnaire, which is a developmental screening tool that's completed from like 1 month through 5 years and 6 months of age. It works to assess the 5 major domains of development that we sort of talked about in the milestone section, and it helps determine if the infant or child is on track developmentally for those different areas, or if further monitoring or potential referral is needed. You'll get some practice completing this during your clinical rotation, so don't worry, you'll hear more about it later. Hemoglobin levels are tested for iron deficiency anemia at about 12 months of age, and then providers should conduct a risk assessment to determine if additional screening is needed at 15 and 30 months. Don't worry about memorizing that. We will talk more about anemia during hematology. A lead risk assessment should also be completed around 6 months, 9 months, and 12 months. We will only do the blood test if the assessment is positive, such as living in a high-risk zip code, which is determined by the public health department, or if the family is in an older home that might have lead-based paint. It is really important to assess and screen for lead because the cognitive delays that can occur with lead poisoning are not reversible. Now, sleep is important for mental and physical development of infants and children, and arguably their parents as well. Sleep patterns for infants will vary depending on their age, and they may not even have a regular sleep cycle until about 6 months, maybe longer. Infants can sleep anywhere from 15 to 17 plus hours a day, and this time will obviously decrease as they get older, but while it seems like that's a long time, and it is, it's important to note that the sleep does not occur at the same time, okay? Especially for newborns who may only initially sleep for about 1 to 2 hours at a time. The typical cycle is the baby wakes, the diaper is changed, the baby eats, and the baby sleeps, and you just rinse and repeat forever. Not forever, but it feels like it. Around 3 to 4 months of age, most infants will develop a nighttime pattern of sleep that can last anywhere from about 9 to 11 hours. And the number of naps that an infant will take can vary as well, usually about 1 to 2 naps by the end of the first year. It is important to note that at first babies should not sleep through the night. My mom used to brag that, I came home from the hospital and would sleep 7 hours overnight and she didn't have to do anything, and who knows how starving I was. But babies sometimes don't have a very good hunger cue. And so a baby that doesn't wake to eat overnight is missing a couple feedings and is likely getting underfed. So SUID is the new acronym for SIDS. This is, and you can use both interchangeably, but this is defined as the unexpected death of an infant with or without an identified cause within the first year of life. So SIDS is one of those preventative education points that I think every nursing student's aware of by now. It's the cornerstone for much of our infant education, so we hear about it in PEDS and OB and probably other courses. Prevention measures include things like putting babies on their back to sleep, using a pacifier, not bed sharing, keeping things out of the crib, not letting them sleep in swings or car seats, and then also some less obvious prevention like avoiding smoking, preventing overheating, and making sure that you're getting immunizations. So I kind of already mentioned the several risk factors for SIDS. You can review them in your book, but some of the more common risk factors are maternal smoking during pregnancy and exposure afterward, as I had said before, co-sleeping, improper positioning during sleep, low birth weight and prematurity, and family history. And here's just a picture of what a safe crib looks like, which has nothing in it, and an unsafe crib, which has several things in it. So safety is a big concern when working with infants and children. Some of the main causes of injury in the infant period include suffocation, motor vehicle related injuries, and drowning. It is really important to consider the developmental skills of the infant to determine what is the most important to teach parents and then prepare for when they're safety proofing the home. Common injury prevention methods are based on the developmental level of the child. So when teaching about safety or baby proofing of the homes, it's important that these safety prevention measures are discussed or provided prior to them becoming an issue. And that's where we get the term anticipatory guidance, right? Now, the acronym SAFEPAD is often used to identify some of the common types of injuries in infants and children, and these injuries can include suffocation from plastic bags or unsafe sleep surfaces or positioning, asphyxia from small food items or toys, falls from stairs, changers, or infant carriers, electrical burns or burns from stoves or curling irons, poisonings or ingestions of medications, and then car safety. Making sure that infants are not left in cars alone and are in rear-facing car seats until at least 2 years of age, or as long as possible, until they reach the highest weight or height allowed by the car seat is what's recommended. And then last, drownings, which can really occur in any body of water, such as bathtubs and pools. So it's important to never leave an infant or child unattended near any body of water. Now moving on to vaccines. The timing of vaccines are determined by two factors, which include the age, when the body's immune system will provide optimal protection after a vaccine, and then the need to provide protection at the earliest possible time based on the highest age of risk. You don't need to know that. It's just important to hear. For the 2025 chart here, I just have it so that you can review. I mean, you should be familiar with it. You're not going to have to memorize the chart because it does change every year, but it's really important to know how to use this resource. Some exam questions will ask about maybe some of the more obvious or critical vaccines, like the meningitis vaccine for teens, and so being aware that that's the age group that they are at risk for meningococcal meningitis, or knowing like which are live vaccines or which ones are given at birth. I think those things are probably ones you want to memorize, but otherwise you should be able to refer to this in the clinical setting if necessary. So if you're interested, there are some mnemonics for the first year of vaccines on Picmonic, which I've mentioned before, but I'm sure other sites have them as well. 2B Dr. Hip and Dr. Hip and other variations of Dr. Hip can help you memorize some of those initial vaccine schedules. So this concludes the infant lecture. We're going to move on to toddler. Have a great day.